My name is Tim Smokoff, CEO of CareXM. We know that we can provide you an even better patient experience through our call routing technology, which delivers clinical calls directly to the clinicians and non-clinical calls to our non-clinical staff. In a nutshell, we can route the right call to the right person, and we do it fast. In forming CareXM, we saw the value of combining nursing-led triage with our non-clinical offering. Whether it's your nurses or ours, the patient experience is enhanced. More recently, we also integrated remote patient monitoring capabilities. In combining the solutions, we're able to provide a more comprehensive solution that supports both reactive as well as proactive triage. Since its formation in 2008, CareXM's nursing triage service has focused on answering clinical calls with clinicians in 1 minute or less, 24 hours a day, 7 days a week, 365 days a year. And 2, we partner with our customers to identify the reasons why your patients are calling. Then, working together, we proactively address those reasons with an eye towards improving efficiencies and the overall patient experience. And 3rd, we're a call center company in the business of actually reducing calls. Rather than take my word for it, we wanted to let you hear from one of our partners, Providence. Thank you again for your consideration.
We operate 13 hospice programs of different sizes in different geographies, all providing hospice care, obviously, but the communities in which they provide care are really different, really different. We were trying singularly to look at how do we rebuild the same structures with different twists on them. And we were only getting incremental change.
The big game changer piece that we don't really talk about enough is the data collection. Like, I'm now able to very clearly see that 18% of my after-hour calls are medication refills. And that gives me this direct intervention. It's no longer 3-hour meetings in a room arguing that the CAP survey isn't fair.
That reliable partner, customer service focused part of your culture and commitment to work with us matters. It really matters. And that mattered in the beginning, it matters in the middle, and it matters today.
But having the nursing background and having a nurse the first time you call answer the phone to help with symptoms immediately has made a significant impact on the care that we're able to provide to our patients and families. And the continuity of communication then back via the report portal, we're able to see what happened all day long. In addition to the layer of support that our call center internally provides, it has significantly improved our communication scores.
Our scores went up 10 percentage points within a year. That's crazy. That doesn't happen.
You can see how many calls we're getting around end of life, the amount of refill requests we're getting after hours, how many patients need help with symptoms, or if there's a DME issue, and being able to have the ability for that transparency to go back and then work directly with the staff and put action plans together that flow up to our quality plan. Like, it's just so the transparency just allows for us to really tackle what our true problems are.
And so that willingness to look at the full interoperability from the standpoint of the patient experience, as woven through our caregivers' workflow, is something that I just have not found in any other vendor. And so I would highly recommend CareXM as a partner to work with for any other healthcare organization.
You have just crossed the holy grail within Providence. Have someone from the IT team say that someone not part of the Providence IT team is highly recommended anything. So congratulations. I wish I recorded that one, Kelly.
Here's the portal. Listen to these calls. How are you coding your calls? What data do you need? You've got to
Or your role
use
set up. Yeah.
So I love you guys. Yes, I would recommend you.
The clinical expertise that CareXM brings to the table, I think, it really, how could we ask for anything more in a partner? To Terry's point, right? It's beyond just a partner for answering the phones in the middle of the night and providing professional symptom management.
The only pieces I would add to that is I do wholeheartedly recommend partnering with CareXM. This is a partnership, and CareXM brings tools, expertise, data analytics, clinical acumen, and reliability to the conversation. But any hospice entity, whether you're small, whether you're medium-sized, whether you're large, whether you're rural, whether you're urban, can benefit from this work and use it to become the program you want to become.